Families have always been the primary source of support for children and adults with intellectual and developmental disabilities, and I'm going to refer to them as people with IDD. In the United States, an estimated 80% of individuals with IDD are thought to get support from their families. More than half of all recipients of Medicaid-funded supports and services for people with IDD live with their families. Many people with IDD continue to live with their families well into adulthood, and this is even more the case with racial and ethnic minoritized groups. One of the biggest challenges related to research about supporting families is the lack of data that's collected nationally. There are few sources of data about family caregivers. National samples that represent the diversity of families across the United States often do not include caregiver questions, so it's hard to determine what the needs are of caregivers and families. Research about supporting families has consistently overlooked racial and ethnic minoritized groups and has focused mainly on families who receive government-funded supports and services. While there has been some research on Latino and Black families, there's been very little on other groups like Asian families or Arab families, just for an example. In the past, research has focused on the challenges and negative outcomes related to family caregivers. There's been less attention to family resilience and the factors that contribute to resilient families. Family research in the past has tended to focus on the experiences of mothers, and that's because mothers do tend to be the main caregiver often of children and adults with intellectual and developmental disabilities. That means that the inclusion of other family members, such as grandparents, siblings, fathers, or other family types, such as extended families, LGBTQ+ families, or families of choice, means that there hasn't been a complete understanding of the family context. One of the things that's happening right now as well that's really important in terms of where we are, most families with intellectual developmental disabilities do not receive federal or state supports for their services. Many states maintain long waiting lists. In Texas, where I am, the waiting list for Medicaid waiver programs, which provide services to people with intellectual developmental disabilities, it's about 15 years. Then once individuals obtain services, the reimbursement rates and dollar amounts can be very low. Right now, a huge crisis nationwide, especially in Texas, is that there's a lack of direct support workers, and the pay is so low that, for example, in Texas, direct support workers' base pay is $8.11 an hour. Fast food places pay at least $15, so guess what, choices individuals might make. So we actually need more research on the experiences of families who are not in the system and their struggle to obtain services, and also more research on the impact of services for those who are in the system. We also need to examine whether there are disparities among those in the system across race and ethnicity, rural versus urban, income levels, and other kinds of differences. More recently in research, there has been some attention to the experiences of siblings, as the Sibling Leadership Network has grown and advocates for the need to include siblings in family research. Some attention has been paid to outcomes of family caregivers from families that have been underrepresented in research, like immigrant families, Latino and Black families. And some of this research has shown that being a family caregiver is experienced differently across these groups and leads to different outcomes. My research is focused on racial and ethnic disparities in health and specialty services for children with IDD, which impacts families. Families may face barriers to accessing key services for their children, such as language barriers, limited economic resources that might be required, lower education levels and information to make the right choices, and also experience discrimination. My research on Latino families suggests that providers need to be more proactive in ensuring they get the right referrals for important services. our research team has also created parent training programs tailored for specific groups to ensure that they are getting the information to access more research sources for their child or for their family. For example, we've adapted a parent education program started with Latino families, and then we adapted it to Black families, Chinese immigrant families. We have a group working on adapting it to Navajo community. And so really important that basically one size doesn't fit all, and that we need to make sure that programs are tailored for different groups. More attention is being paid to the fact that families provide support across the lifespan, and that supporting families extends far beyond parents of school-age children. There's also a recognition that family caregivers of individuals with IDD have a different experience than other family caregivers. For example, the FIND survey found that family caregivers of adults with IDD provide more hours of support, more supports, and for longer periods of time than did caregivers responding to other caregiver surveys, such as the National Survey on Caregivers, which often focuses on caregivers of adults who are aging or older adults. Over the past 20 years, there has been an increased recognition about the importance of families and the need to provide better supports to families. The Family Support Research and Training Center was funded by the Administration on Community Living to engage families and stakeholders in investigating the needs of families who support their family members with disabilities, and in exploring the kinds of supports and promising practices that are needed for families to fulfill this important social role. The FSRCT, as I will call it, Family Support Research and Training Center, created a strategic plan for family support research and conducted 6 different studies that range from caregivers whose adult children were in managed care programs, identifying promising family support practices, and developing parent education for Latino families. Other work aimed at supporting families includes the development of a community of practice of states that are using the Charting the Life course as a way to help families think about what makes a good life and how to get there. A key component of Charting the Life course is the need for social networks and ties to communities rather than dependent solely on paid services. Charting the Life course is a family-centered approach that builds on and contributes to family resilience. So in order to better understand families' needs and what kind of supports they want and need, we need to make sure that we're including different stakeholder voices in that process, in the research. We need to include people with disabilities as well as family members, and make sure their voices are heard. Steps to more adequately and accurately capture the experience of family caregivers in communities of color include practices such as oversampling underrepresented racial and ethnic groups, immigrants and refugees, and comparing family caregivers' experiences across race, ethnicity, and culture. Important research questions include: what are research strategies that are effective in being more inclusive of families from racial, ethnic, linguistic, and cultural groups? What funding streams are used for family support services, intervention and programs by state? Are there additional funding streams states could use? Can family navigators help underserved families have improved access to needed supports and services? Can family navigators combat systemic disparities? What are the support needs of families across the lifespan? What are the strengths of families from marginalized communities in relation to family support? How do families support a disabled person in their families and communities? How can communities be strengthened to support families? What are the experiences of parenting in the context of having a child who's from a minoritized group? What are parents' aspirations and worries?